Imagine waking up on an ordinary morning. You get out of bed, walk to the kitchen, and suddenly, a small stumble. In a split second, everything changes. A fractured hip, surgery, rehab, months of recovery, and for many, independence is never quite the same again. But what if I told you that up to 90% of these fractures could be prevented? Osteoporosis, the silent disease that weakens your bones, affects over half of women and nearly one-third of men over the age of 70. And the most frightening part, most people have no idea they have it. Have you ever had a bone density scan? Do you know which foods actually strengthen your bones? Or which type of exercise can protect you from devastating fractures? In this video, you'll discover everything you need to know to keep your bones strong and avoid life-altering injuries, even if you've already been diagnosed with osteopenia or osteoporosis. We'll talk practical nutrition, effective medications, accessible exercises, and simple changes in your home that can save your mobility and maybe even your life. You'll meet Margaret, who rebuilt her confidence at 74 after a painful fracture. You'll learn how Robert, now 81, kept his bones strong without ever leaving his living room. And you'll understand why prevention today is always better than treatment tomorrow. You're about to learn how protecting your bones is protecting your future. Let's begin. Osteoporosis. It sounds clinical, distant, something that happens to other people. But the truth is, it may already be affecting you or someone you love, and you wouldn't even know it. Osteoporosis is a disease that causes bones to become thin, weak, and fragile. It doesn't happen overnight. It develops slowly, quietly, over the years. And that's the danger, because it gives no warning signs, no pain, no swelling, no visible changes until a bone breaks. This isn't just about fractures. This is about independence, mobility, dignity. Healthy bones are constantly renewing themselves. Our bodies break down old bone and build new bone in a balanced cycle. But as we age, this balance changes. After age 50, bone breakdown often starts to outpace bone formation, especially in women after menopause due to falling estrogen levels. The result is a loss of bone density that can turn strong, solid bone into something brittle and hollow inside, like a sponge full of air pockets. This internal weakening makes the bones more susceptible to fractures from things as minor as bending, coughing, or a small stumble. There are two main stages of concern: osteopenia and osteoporosis. Osteopenia is the early stage where bone density is lower than normal but not yet dangerously low. Think of it as a warning light on your car's dashboard. It's a signal to act now. Osteoporosis is more severe and means that your bones have become significantly weaker. Let's return to Helen, the retired teacher. When her wrist fractured reaching for a dish, she was stunned. She never imagined a simple motion could break a bone. Her diagnosis of osteoporosis opened a door she didn't expect, one that millions are stepping through each year. But she's not alone. Take James, 76, a former firefighter who thought his active past guaranteed strong bones. He jogged occasionally, never smoked, and took daily vitamins. But after tripping over his dog's leash and breaking two ribs, he discovered he had been living with undiagnosed osteoporosis for over a decade. According to the National Institutes of Health, 1 in 2 women and up to 1 in 4 men over age 50 will break a bone due to osteoporosis. It's not just a woman's disease and not just an issue for the frail. Fractures related to osteoporosis are most common in the hip, spine, and wrist. Hip fractures are particularly devastating. They often require surgery and long-term rehabilitation, and studies show that up to 20% of seniors who break a hip die within a year, largely due to complications. So why is osteoporosis still underdiagnosed? Because it doesn't announce itself. There's no ache to warn you. You could feel perfectly healthy and still have dangerously weakened bones. That's why medical professionals call it the silent disease. There are many myths that make the problem worse. Only women get osteoporosis. Not true. Men are affected too and often diagnosed later, when consequences are more severe. It only happens if you're inactive. Also false. Even those who walk daily or eat well may still be losing bone if other factors are involved. Bone loss is just a normal part of aging. No, it's preventable, manageable, and treatable with the right steps. Here's the reality. Osteoporosis doesn't have to take you by surprise. By the end of this video, you'll understand how to build stronger bones, how to get screened, and how to change the trajectory of your aging process starting today. Because you deserve to stand tall, move freely, and live with confidence for years to come. When we think about risk, we often look for the obvious signs: visible illness, clear warning symptoms, or family history. But with osteoporosis, risk can be hidden in plain sight and much more common than most people realize. Let's begin with the basics. Age is the biggest risk factor. As we grow older, the balance between bone formation and bone breakdown shifts, with breakdown speeding up and formation slowing down. By the time we reach 70, most people have experienced some level of bone loss, even if they feel perfectly healthy. Women, especially those who are postmenopausal, are at highest risk due to the sharp decline in estrogen, a hormone that plays a key role in preserving bone mass. But men are far from immune. In fact, because osteoporosis is so often seen as a women's issue, many men go undiagnosed until after a fracture. Then there's family history. If your mother or father had osteoporosis or broke a hip later in life, your own risk is significantly higher. And this isn't just about genetics. Family habits around diet, movement, and healthcare matter too. But other risk factors are less visible and sometimes overlooked even by doctors. Certain medications can accelerate bone loss. Long-term use of corticosteroids, such as prednisone, often prescribed for arthritis, asthma, or autoimmune conditions, can weaken bones quickly. So can medications for seizures, some cancer treatments, and even certain antidepressants. Lifestyle choices matter deeply. Smoking interferes with bone-building cells. Excessive alcohol weakens bone formation and increases fall risk. And a sedentary lifestyle, spending too many hours seated, causes muscles and bones to lose strength from disuse. Let's look at Diane, 73, who was shocked to learn she had osteoporosis despite staying slim, walking every day, and eating normally. What her doctor explained was that her low body weight actually put her at greater risk because she had less bone mass to begin with. She also had been taking a proton pump inhibitor for acid reflux for over a decade, another hidden culprit in bone loss. Even nutrition history plays a role. People who didn't get enough calcium or vitamin D earlier in life may start their senior years with weaker bones without ever realizing it. And some chronic conditions like rheumatoid arthritis, type 1 diabetes, and thyroid disorders are linked to faster bone loss as well. We also have to talk about race and ethnicity. While osteoporosis affects people of all backgrounds, studies show that white and Asian individuals are at slightly higher statistical risk. But African American and Hispanic seniors are often underdiagnosed, and when they do break a bone, they face more complications and longer recovery times due to disparities in access to care, late diagnosis, and lower treatment rates. That's why a one-size-fits-all approach simply doesn't work. Here's the bottom line. If you're over 65, have a family history of fractures, take certain medications, or live with any chronic illness, you need to know your bone health status. That means asking for a bone density test, known as a DEXA scan, because the earlier we identify those at risk, the better the outcome. And the truth is, many people, even those who look active and healthy, are walking around with fragile bones they can't see and don't suspect until it's too late. But you're here now, learning, asking. That's the first step to breaking the silence before a bone breaks you. You are what you eat, but when it comes to your bones, you are also what you absorb, and that makes all the difference. Nutrition is one of the most powerful and most overlooked tools for protecting bone health. The right foods and the right balance can help slow bone loss, support new bone formation, and reduce your risk of fractures. Let's start with the obvious hero, calcium. Calcium is the main building block of bones. Adults over 70 need about 1,000 to 100 milligrams per day, according to the NIH. But here's the surprise: most older adults aren't getting enough. And no, it's not just about drinking milk. There are many sources of calcium. Leafy greens like kale, bok choy, and collard greens, fortified plant milks, and orange juice. Low-fat dairy products like yogurt and cheese can fish with bones, like sardines and salmon. Calcium-set tofu, almonds, sesame seeds. But calcium can't do its job alone. Enter vitamin D, the gatekeeper. It helps your body absorb calcium from the food you eat. Without it, much of the calcium simply passes through unused. Vitamin D comes from sunlight, but with age, our skin becomes less efficient at making it. Add in less time outdoors, sunscreen use, or cloudy winters, and you may not be making enough. That's why many older adults need supplements, typically 800 to 1,000 IU per day, but always check with your doctor before starting. There's another key player: protein. Yes, protein. Bone is made of more than just minerals, it also needs collagen, a protein framework. Older adults often eat too little protein, which slows repair and weakens the musculoskeletal system. Eggs, beans, lentils, lean meats, dairy, and soy are excellent sources. But balance matters. Too much salt, caffeine, or alcohol can interfere with calcium retention, and some fizzy sodas contain phosphoric acid, which may weaken bones over time if consumed excessively. Let's meet Lillian, 82, who lived alone and ate mostly toast, tea, and soup from cans. She never imagined her light diet could be harming her bones until she broke her ankle stepping off a curb. A nutritionist helped her rebuild her strength with small, affordable dietary changes, adding yogurt with chia seeds, cooking canned salmon with kale, switching to fortified soy milk. These are not extreme shifts, but they are life-changing. And hydration matters too. Dehydration can reduce nutrient absorption and increase fall risk due to dizziness. Older adults often don't feel thirsty, so intentional water intake is essential. For those with lactose intolerance or digestive issues, don't worry, there are many non-dairy sources of calcium and D. And if you have kidney disease or take medications that affect nutrient balance, your doctor or a dietitian can guide you safely. What about supplements? They help, but they're not magic pills. The CDC and NIH recommend using supplements only to fill gaps, not replace meals. Excess calcium, especially from supplements, can cause kidney stones or interfere with heart health. Here's the rule: food first, then fill the gaps. And don't forget the power of shared meals. Cooking with a loved one, sharing recipes, or joining a senior cooking class can turn bone health into a community habit, not a chore. Nutrition is one area where you have real control. Every meal is a chance to protect your future one bite at a time. Movement is medicine, especially for your bones. The myth that seniors should take it easy or avoid certain movements is not only outdated, it can be harmful. In reality, the right kind of physical activity is one of the most effective ways to preserve bone density, improve balance, and reduce the risk of falls and fractures. Let's start with a key principle. Bones get stronger when you challenge them. Just like muscles, bones respond to stress, in this case, mechanical load. When you walk, lift, climb stairs, or practice controlled movements, your bones receive a signal. We need to stay strong to support this activity. Without that signal, bones weaken faster. That's why weight-bearing and resistance exercises are essential. Weight-bearing doesn't mean lifting heavy weights. It simply refers to activities where you move against gravity while on your feet, like walking, dancing, hiking, or stair climbing. Resistance training involves pushing or pulling against resistance. It can be body weight, resistance bands, light dumbbells, or even water in a pool. Let's meet Edgar, 78. After retiring, he became less active. A mild back fracture changed everything. His doctor recommended a bone-focused exercise program, not intense gym workouts, but simple, guided routines using resistance bands and gentle leg lifts. In 6 months, not only did his balance improve, he felt steadier, more confident, and even slept better. Some of the best exercises for seniors include Tai Chi, which improves balance and coordination, chair yoga or standing yoga poses for flexibility and bone loading, while push-ups and light squats for upper and lower body strength, walking 20-30 minutes a day with proper footwear. But not all exercises are safe for everyone. High-impact activities like jumping or running may pose risks for those with severe osteoporosis. So can movements that involve twisting the spine, bending forward sharply, or sudden jerks. That's why it's vital to consult with a physical therapist or trained instructor before starting any new program, especially if you've had fractures, balance issues, or chronic conditions like arthritis. Some senior centers and YMCAs now offer bone health fitness classes, specifically designed to reduce fall risk and build postural strength. Let's talk about balance. Many fractures happen not because bones are weak, but because a fall occurs. That's where exercises that train balance, posture, and coordination make a life-saving difference. Standing on one foot while holding a counter, heel-to-toe walking, or practicing sit-to-stand from a chair all build neuromuscular strength. And don't forget the emotional impact. Regular movement increases confidence, reduces fear of falling, and improves mood. Exercise stimulates the release of endorphins and supports better sleep, digestion, and circulation, all vital in preventing age-related decline. Let's return to Margaret, now 74. After a painful hip fracture, she feared moving too much. But working with a physical therapist at home, she slowly rebuilt strength. Today, she walks twice a day and leads a small stretching group at her senior apartment complex. Her message? It's not about doing more, it's about doing enough, safely and consistently. So wherever you are on your journey, whether you've never exercised or used to be an athlete, there is a place to start. Your bones are listening. Give them the signal they need. While diet and exercise form the foundation of bone health, sometimes lifestyle changes alone are not enough. When osteoporosis is diagnosed or when bone loss is progressing rapidly, medical treatment becomes essential. But here's the good news: we have effective tools. Let's start with bone density testing, also known as a DEXA scan. This painless test measures how dense or thin your bones are, usually at the hip and spine. It takes only a few minutes but gives powerful insights into your risk of fractures. The result is called a T-score. A score above -1 is normal. Between -1 and -2.5 is osteopenia. Below -2.5 confirms osteoporosis. This score is your starting point, your baseline. From here, your doctor can decide whether to monitor or begin treatment. For those with osteoporosis or high fracture risk, medications can make a big difference. Let's break them down into categories. 1. Bisphosphonates. These are the most commonly prescribed drugs. They slow bone loss and help prevent fractures. Examples include alendronate fosamax, risedronate actonel, and zoledronic acid reclast. Some are taken weekly as pills. Others are infusions once a year. 2. Denosumab, an injection given every 6 months. This drug reduces bone breakdown and helps build bone density, especially useful for those who can't tolerate bisphosphonates. 3. Anabolic agents. These actually stimulate bone formation. Drugs like teriparatide or abaloparatide are daily injections used for severe cases. 4. Hormone-related therapies. For some women, estrogen or SERMs like raloxifene may help preserve bone post-menopause, but they come with more risks and must be used cautiously. Let's meet Joyce, 77, who had severe spinal osteoporosis. Her doctor started her on monthly alendronate and prescribed a vitamin D supplement. After a year, her bone density stabilized. More importantly, her fear of everyday movement began to fade. She could walk with her grandchildren again. But medication alone isn't enough. Monitoring is key. Doctors recommend repeat DEXA scans every 1 to 2 years, especially if you're on treatment. These scans help assess progress and guide decisions like whether to switch drugs, stop, or continue therapy. It's also important to discuss side effects. While most people tolerate treatments well, some medications can cause heartburn, jaw discomfort, or flu-like symptoms. Rarely, bisphosphonates have been linked to jaw bone issues, but this is very uncommon, and your doctor will monitor for it. Another critical aspect: medication interactions. Many seniors take multiple medications for blood pressure, diabetes, cholesterol, or arthritis. That's why a full review with your pharmacist or primary care provider is essential to avoid conflicts that weaken bone health or affect absorption. And if you've already had a fracture, your treatment plan may need to be more aggressive. In some cases, doctors may refer you to a bone specialist called an endocrinologist or rheumatologist. The goal is not just to protect the bones you have, it's to build back strength and prevent the next fracture. Regular checkups, blood tests for calcium and vitamin D levels, and honest conversations with your doctor all play a role. Because treating osteoporosis isn't just about numbers on a scan, it's about staying upright, independent, and confident in your body. Remember, bones can be rebuilt. Progress is possible, but it starts with action and continues with consistency. Fractures don't just break bones, they break routines, confidence, and in many cases, independence. In older adults, fractures often mark a major turning point. They can lead to hospitalization, loss of mobility, long-term care needs, and even increased risk of death. But most fractures don't happen in dramatic accidents, they happen in familiar places, doing everyday things. Let's talk about the most common sites. Hip fractures are the most dangerous, often requiring surgery and long recovery. Wrist fractures happen from catching a fall. Spinal fractures can occur from bending or lifting something heavy, sometimes without a clear injury. Now imagine this: 2/3 of all falls happen at home, the place that should be safest. Let's revisit Margaret. After her hip fracture, she realized it happened not during anything risky, but while stepping sideways to reach a dropped phone, she caught her foot on the corner of a rug. That small moment changed her entire year. But here's the key: most fractures are preventable, and prevention begins with environment. Here are practical steps to make your home safer. 1. Remove loose rugs or secure them with non-slip pads. 2. Install grab bars in bathrooms and near stairs. 3. Ensure good lighting, especially in hallways and entrances. 4. Keep floors clear of cords, shoes, or clutter. 5. Use non-slip mats in the shower and kitchen. 6. Place frequently used items within easy reach, no climbing or bending needed. Many falls also happen due to poor footwear. House slippers with worn soles, socks on hardwood floors, or shoes without support increase the chance of slipping. Choose shoes that are flat, supportive, and have non-slip soles. Then there's vision, a factor often overlooked. Cataracts, glaucoma, or outdated prescriptions can make it harder to detect depth or edges. Regular eye exams are part of fall prevention. So is hearing. Poor hearing affects balance and spatial awareness. If you use hearing aids, wear them consistently. But what if a fracture does happen? The first hours are critical. If someone falls and can't get up, immediate help is vital. Devices like emergency call buttons, wearable fall detectors, or even voice-activated assistants can make the difference between timely care and serious complications. Let's look at George, 80, who fractured his spine lifting a laundry basket. He thought it was muscle pain, waited days before seeking care. The delay caused prolonged healing and affected his posture permanently. Don't ignore unusual back pain, loss of height, or sudden weakness. These may be signs of compression fractures. Once a fracture has occurred, rehabilitation becomes the focus. Physical therapy, assistive devices like walkers or canes, and home modifications all play a role. It's not about returning to normal, it's about building a new normal with strength and safety at its center. Fractures are not just accidents. They're signals, messages from your body and environment saying, something needs to change. But with the right information, that change doesn't have to be scary. It can be empowering. Your bones are more than just your skeleton. They are your foundation, your freedom, your future. Every step you take, every hug you give, Every dance you enjoy, all of it, depends on the silent strength beneath your skin. And while osteoporosis may be invisible, the choices you make today can shape what tomorrow looks like. We've talked about silent risks, unexpected fractures, medical treatments, and home adaptations. But more importantly, we've talked about empowerment. Because bone loss isn't a sign of failure, it's a signal for change, a chance to act, to eat better, move more, ask questions, to talk with your doctor, to open the conversation with your family, to protect not just your health, but your independence, your joy, your life. Let's remember Margaret, Edgar, Lillian, George. Their stories reflect millions more. Each one proves that it's never too late to take action and never too early to start protecting what truly matters. If you're watching this video, you've already taken the first step. You've chosen awareness over avoidance, prevention over regret. Now it's time to go further. Schedule that bone density test. Review your home for hidden hazards. Rebuild your plate and your bones one meal at a time. Start moving, even if it's 5 minutes a day. Talk to someone. You are not alone, because protecting your bones is protecting your ability to live fully. Strong bones, steady steps, a future you can walk toward one day at a time.